Great to be here, and I have the privilege to stand between everybody and lunch. That's quite tall. Really excited to be here because it's really touching on two topics that are close to my heart. One is about how to drive research in AI and how to apply it to perhaps the most significant opportunity that we have with AI, which is to impact everybody's life by advancing and transforming healthcare. So I'm going to talk a little bit about how healthcare transformation and science acceleration are really enabled now with AI. And if there's one thing to keep in mind is that everything that we're hearing, not only in my talk, but throughout the day, is what's happening now. And just reflect a little bit about how much of what we have today existed just a couple of years ago or a few years ago, and just project into the future, a lot is still going to change. In terms of background, I've always been excited about two areas. One is about how to drive scientific research. From my early days in Bell Labs, in the Mathematical Center, looking into how to solve some of the scientific questions that, some of them from theoretical ones to ones that are motivated by real questions, applied questions, and how to build products. So I'm also an engineer by heart, and asking how to actually build systems and products that can make a difference in so many levels. But really, what I'm mostly excited about is how to actually bring them both together. In fact, in my almost 20 years at Google, for over 10 years, I was actually on part of the search leadership on products such as autocomplete and search, Google Trends, and other experiences, and now leading Google Research, where our mission is very simple, is to look into the art of the possible and take the impossible, make it possible. Now, when I talk about these two areas, actually, what I'm really excited about is what I call the magic cycle of research. How we ask research questions that are motivated by their potential impact. Let's call it intentional curiosity. All scientists typically are growing up because of some curiosity. At some point, you ask questions that would matter. Then, once you have research breakthrough, applying it to reality. Reality is about improving products. It's about science. It's about societal impact. And once you have an implementation or manifestation of some of the research breakthrough into reality, then this actually brings up the next question, the next research. That's why it's cycle. It's never a technology transfer, as sometimes people refer to it. It's really a cycle of research and reality. And when we're thinking about at Google, of course, we have the opportunity to have reality in terms of products. There are 8 products with more than 2 billion monthly active users. And reality is also applying it to science and to societal impact. So what do we do at Google Research? We're actually looking into pretty broad areas, spectrum of areas, anything that we should care about, from foundational machine learning to generative AI foundations to AI for science, AI for society, quantum. I'll touch on very few of them. I'll focus mostly on the health. But just to give a sense of the work that is opportunity for generative AI foundations, so we're all now know and hear about models, but there's so much more work to be done about how to make them more efficient, more factual, how to get new experiences. Just to get, for example, on some algorithmic work from a few years ago on generative AI, we could make LLM inference, the pace in which we produce tokens, actually be more than twice faster and more efficient without any loss of quality. So the entire world today actually operates as if we had more than twice the chips. Or thinking about factuality, reducing hallucination. This is a problem that we're researching since 2021 and made a lot of progress, but still a lot of work to be done and so forth. But let me actually focus on healthcare, because that's actually an area that's the topic of this conference, and as I mentioned, area where I think we're going to have some of the biggest impact that we can imagine. Take diabetic retinopathy. This is actually, our work on healthcare is not new. It's actually started out, we had a legacy paper from 10 years ago now, this year, about how to identify diabetic retinopathy with a classical AI, if you will. And this paper, which was selected as one of the top papers of JAMA of the decade, actually showed that with AI we could do that in par with experts. Now, research alone is not good enough, of course, unless you bring it to reality. And this notion of bringing research to reality actually takes a lot of work. In fact, we just published a couple of years ago a paper in Nature Medicine about our experience taking that basic research, bringing it to clinical reality with partners in India and Thailand. And by now, this is actually already there. In fact, I was visiting there a couple of years ago in a clinic in Bangkok, seeing how a patient sits in front of a camera, getting a screening, and in 2 minutes getting diagnostic that can save them from blindness. 2 minutes. Now, previously, it took a few weeks to actually get a result that was not as accurate because it was not from an expert. But also, importantly, because it was a few weeks later, it took them not everybody actually followed up on that. And now, most people would follow up out of the clinic. By now, we had more than 1 million screenings and are set with partners to actually go to 6 million in the decade. So this is an example for what I would call a legacy kind of AI application. Now let's talk about developing breakthroughs to help improve health outcome in many other layers. For example, and we are hearing a lot here in this conference about it, about the opportunities to use it in diagnostics, in radiology, in many other areas. So the path to impact actually can go through many areas. For example, how to support the evolution of healthcare providers in the AI era. Now, the examples I gave earlier were on so-called classical AI, if you will, how to use machine vision, etc. But with large language models, it opens up new opportunities. And our journey here actually goes into exploring from how can we actually trust languages in medical information. And there was a benchmark actually looking into US-style medical exam. And for years, actually, AI, of course, could not do as well as US-style medical exam. In a published work in Nature some 3 years ago, we showed that in a model called MedPalm, for the first time, we could actually show a model that is fine-tuned to pass US-style medical exam in a passing score. By the time this was published, actually, we had a model doing it in expert level, but importantly, also having partners such as HCA already implementing it. But going through this magic cycle and iterating between testing in and providing it, we now got into looking into how can you use AI in medical diagnostics. And in, again, sequence of research works that we take a very measured approach, seeing that we can measure and see AI to be helpful and AI to be score in par with what you'd expect from experts to do. So you can actually think about it that if put in the field, you could have actually practitioners use AI as if they had assistants collaborating, helping them in what they're doing. It's all about empowerment. In the system, this system called AMI for Articulate Medical Intelligence Explorer, we showed that various aspects that you can measure, including helpfulness, even empathy, understanding, and accuracy, can be in par with what you'd expect from experts. And by different scores, you can then also add guardrails, so you can actually supervise that and help it as a way of assistant that would help you do that. Now, we're now at evaluation scale with Included Health, which is a virtual health treatment to actually take the next level of testing it out. Let me give examples of how we can use AI to help people in their daily understanding of healthcare. Because if we can do a better job on how to take care of ourselves, obviously this would make a big impact. Recently, we had launched what we call Google Health App, which actually provides kind of advice on an ongoing basis based on signals that you can get from your watch. This is based on, again, a sequence of researchers that looked into how can we take language models and personalize them, train them using the signals that you can actually collect on your sleep, on your pulse, on other factors. And there are many other applications, startups, companies who are providing information so you can do that. So we see the trajectory, and this is really on a way to actually get a better understanding of what we can do in terms of coach, in terms of helping with advice, in terms of identifying early signals that you should actually go and check out and talk to a doctor to see if something requires extra attention. This is on a personal level, but if you think about the global health ecosystem, one question is how can we actually empower the entire ecosystem to actually do more, to be more successful, to move faster and more efficiently? To that end, we looked into the following question: can we take our models and make them available so that others can actually build on them their own applications, their own solutions? Because at the end of the day, when you think about the opportunity, we cannot have a one bullet, a silver bullet of one-size-fits-all solution. In fact, you'd like every community, every organization, every type of application to build their own. To that end, we put out what we call HiDef, which is essentially an open platform for healthcare models. And on that, we looked into taking a language model, open language model called Gemma. Gemma is the open source model of Gemini. Add to that our best medical model, healthcare models. And models can be anything from language models, from speech recognition models, from image understanding models, and keep on adding to that. And we put it out there as a platform so that everybody can build and use on that. And just actually yesterday I visited, we had this workshop with amazing startups that were looking into how to build their solutions on that. Within about a year, we had more than 5 million downloads, thousands of applications, many of them we wouldn't imagine. So it's really about empowering. It's creating a new layer that everybody can actually build on, take it as a baseline, and build their innovation and solutions on top of that. And this is really using our best possible models. But when you think about solutions and the impact, you can talk about statistics, the fact that there are thousands of such opportunities, thousands of such solutions, including, for example, I talked earlier about diabetic retinopathy, but there are many other eye diseases. And I met just a few months ago an entrepreneur who was set up to build a frontier model for all eye diseases. So she took MedGemma and she built on top of that her solution, which is now under FDA approval. And she was telling me, without MedGemma, actually, it would take her probably 3 years to just get to the point that she can actually build her solution. But you know, we're talking about numbers, but it's really the single stories that are really touching us. And I just a few weeks ago heard about this story about a healthcare worker that came in a village in Uganda. And there was a woman who was about to give birth, and she was in distress, and she couldn't find any advice. So she actually used an application that somebody developed based on MedGemma, and it was offline. No internet connection. It was on the phone. And with that, actually, she helped serve the mother and the baby. Actually, there's this a very touching testimonial related to that let's try to play. Let's see if we can make it play. Can we play the video? Thank you. Can we make voice? That's the point where I'm saying that we're solving AI, but AV is still difficult. Okay. Let's just move to the next slide then. Let's just continue the presentation then. Encourage you to check it out online, this testimonial. So, MedGemma, there are many applications of that, including in India Health Foundation models, and many partners who are actually building it for their own applications. And once you put a platform, I mean, we've seen it with Android, right? We put an Android platform, and then we had all the applications based on that. So I think about it as a layer that can encourage everybody to do, and we're looking into other ways in which we can actually develop the ecosystem, including some efforts that we have on data interoperability and more. Let me switch to another layer of how AI is really helping transform healthcare in society. And let me talk about public health and planetary intelligence. So first about planetary intelligence. We care about planetary intelligence for multiple reasons, about questions about the planet. In fact, one of my roles at Google, I'm overseeing what we call crisis resilience. Whenever there's a natural disaster, people come to Google to ask questions about what's happening, what should they do, and we actually put out at Google Search something we called SOS Alerts that provides authoritative information. We had billions of views on that since we launched it a little less than a decade ago. However, after we launched it, I discovered that we are not very helpful on one natural disaster, which are floods. This is a video taken in a village in Bihar in India, and I was actually visiting that village just a few days after seeing the aftermath of this flood that actually came overnight, flooded the village. With a few people perished in that flood. And the problem was that nobody could actually warn anybody about the flood coming in. And at the time I actually asked experts about floods. The answer I got was that nobody has an answer, can predict floods. So this is an opportunity, this is the kind of thing that we're doing, looking into, okay, if there's an important problem, can we do anything about it? And in a journey of actually driving research and iterating, starting in India, expanding to India and Bangladesh, and then to more countries, and driving, working with the academic community on research, we got into understanding floods enough to build a hydrological model we published in Nature, and also built a system that is now providing up to 7 days prediction in 150 countries, and covering 2 billion people. So, and this is already helping save lives, and now also expanded to flash floods in using other techniques. Now, the same that we did with floods, we're also looking into storms. How can we predict storms so we can actually warn? So recently, actually, people in Jamaica were warned about a hurricane coming their way using models that were developed by our researchers at Google. But then we asked ourselves, can we actually bring all of them to all the geospatial models that we have as a family of models under one umbrella called Earth AI? Put AI agentic layers so you can ask any question about planetary intelligence, not only where is the flood, but what are the vulnerable communities? Not only where the storms are going to hit, but how can we help the communities that are at highest risk? And with that, when you think about public health is much about planetary intelligence, and we already have partners that are using it for asking questions about not only crisis resilience, but also outbreaks, about various public health questions and so forth. And just recently we had some partners actually publishing in Nature some measles vaccination in the zip code level using planetary intelligence. Let me switch to what I think is the most exciting, which is how to advance science itself with AI. Now, our work to advance science is not new. We've been working on genomics for over a decade. We collaborated on how to build foundational models for full understanding of simulation of a cell using language models. And we used it, of course, in other ways. But really the promise that I see as the strongest one is how to accelerate scientific discovery itself. In a system called Co-Scientist that we published last year, and actually was just actually appeared in Nature, we showed that you can have a multi-agent system that does essentially what typically we expect from a research lab to do. Essentially doing literature search, and doing exploration of all literature in response to a research question, then creating hypotheses. And you can generate dozens or hundreds of hypotheses and then rank them and bring it back to the researcher. So think about it as a kind of essentially a research lab that doing the work for you. And we had quite a few partners actually. This already had some initial encouraging results, anything from new drug repurposing for liver fibrosis to hypothesis in 3 days, hypothesis on the same question that our colleagues in Imperial College actually worked for a decade to get to the same hypothesis. So essentially it's an empowerment system for asking scientific research. And it's extremely powerful. So envision a world in which every grad student is going to have a virtual lab in their disposal so they can ask bigger questions, move faster on these questions. And that collaborator is a polymath because it can actually read the entire literature in all aspects. It's like having a polymath in your pocket. And that's not the only tool that we have here, because another aspect of any advancing research is building models. In fact, quite often this takes more effort than everything else, is to build models for any known questions. And this building models actually is in a way to have a solution. To that end, we looked into a system called Empirical Research Assistance, also published in Nature just a few weeks ago, where for any scoreable problem, it would search thousands of possible models and parameters and build a model for you. And by the time we actually published this paper, there are already results from cosmology to economy to engineering and so forth that could accelerate research based on ERA, or an empirical research assistance. So think about it, that now people can do research in an area even if they don't have the expertise to build those machine learning models, or they don't have the funds to hire data scientists to do that, and do that much, much faster. Now, we actually put these out as what we call Gemini for Science. Essentially, these are tools for hypothesis generation, for computational discovery, also adding literature insights. And we're now seeing that we can accelerate scientific research, published research, building models, testing out there. And this is really one of the biggest premises that we see. At the same time, the scientific method is more important than ever. So we need to support it in various levels. Well, for example, we use AI in order to help review papers. This is an experiment we've been doing it with multiple conferences where actually authors could get feedback on their paper, and we're looking into how can we actually keep supporting the scientific method. Let me end with just a mention of when we think about the future of acceleration, one of the big opportunities is about new paradigm of quantum computers. And quantum computers are going to unlock opportunities beyond what we can do today. This has been a long journey. This is actually a picture here with Michel Devoret, who was just got the Nobel Prize for his work in the 80s with John Martinez and John Clark. Michel is actually chief architect in our Harvard team in the AI lab, in our quantum AI lab. And we've been building a quantum computer since 2012, and just recently actually had a few milestones, including a chip with 105 qubits with better error corrections, as well as showing that a certain common problem, we can actually show advantage, verifiable advantage of quantum computer by a factor of 13,000. So really, this is a new opportunity that we envision. In fact, we put out this collaboration with academics about an initiative to apply quantum science and AI for life sciences. Let me just close on why am I so excited about where we are. It's really about magic cycle of research accelerating with AI. AI is helping us not only accelerate research itself, it's helping us accelerate the research to reality with our tools such as AI Co-Scientist, empirical research assistants, with platforms such as Earth AI and MedGemma and so forth. And it's really about working through the full stack. But the most important thing about AI is an amplifier of human ingenuity. AI empowering the doctor, the nurse, the teacher, the scientist. We're hearing a lot and here and elsewhere about the question, replacement or not. One thing to keep in mind is that what we're doing is not fixed. In any given moment, we're doing what we can do given all the technology and the knowledge that we have. And once we get the tools, we're doing much more. Scientists today are working with tools that did not exist before. They're working with computers. They're working with machines that actually solve things that previously could require many more things. I was once asked, with AI Co-Scientist, are you going to have less researchers? And my answer is we're going to have many more. Think about it, with AlphaFold, we don't have less biologists. We have 3 million users of AlphaFold. They are not working on protein folding. They are working on building on AlphaFold. Similarly, with this new era of AI, we're going to have And we heard earlier today about the fact that we have now more radiologists doing work which is more important, and we have much more radiology screening out there, in contrast to predictions a decade ago about radiology and AI. So really we are getting at the era that AI is amplifying human ingenuity in all aspects of life. And this is, to me, this is not a prediction, this is a design goal. That's how we need to build our systems. That's how we need to make the transformation on training, on educating, and in how we operate. And I think that we are at the verge of actually getting into a step function of answering more questions in science, in healthcare, have better treatment. And everybody sitting here, thank you for the work that you're doing, and thanks for engaging in such conversation, because actually that's how we can take AI and make the impact on humanity. Thank you very much.
It's an overview of what will be the future of AI in medical sciences and health scenario. You have covered the various aspects which is going to be the future. What is the lessons learned from COVID? How such kind of a disasters we can prevent in the world with your various aspects of it, you took about it. And in a country like India where we see various kinds of infectious diseases and the problem, I think there is a good scope that how we can integrate with each other and take it forward in identifying certain epidemic infectious disease program and take it forward. So.
Yeah, I think it's a great question. So already with COVID, we learned a lot. And by the way, I mentioned earlier, as a first thing, we learned that the importance of getting the right information to people. So as somebody in charge, that I had the responsibility of giving the response in search at Google. I mentioned earlier, we had SOS Alert, and we found out that just making sure that people are getting the authoritative information, that alone can save lives. But that's not enough. The question is, how do we actually identify it early on so we can actually take actions? In fact, one of the papers that I showed in the context of empirical research assistant showed that with using ERA, empirical research assistant, got the best result of COVID prediction benchmark that the CDC put out as how do we actually predict those. So the opportunity to do that in real time is becoming important because it then allows for actions. And by the way, Earth AI, as I mentioned, is used now for public health research in order to identify those. And you can imagine that now with Ebola, for example, there's a lot of discussions to see how to use planetary intelligence in order to see how to help out. So I envision that in the future we're going to be much better in real-time analysis and providing those who need to take action decisions, for example, the basic information of where things are. But also, some of the premises of these systems and acceleration is trying to tackle problems that today are not solved yet. For example, we have a team looking into if we can make some progress on ALS and other rare diseases where actually there's not enough information. Now, my hope is that with eco-scientists and the like, we're going to able to learn much, to make advances beyond what we can do today. Just because the ability to look through, not only through literature, but at some point also through all the failed experiments, to actually bring together more data. Some of it requires, these are conversations that I had also here and elsewhere, about how can we bring more data to AI models that can then learn about more information out there. And again, in some of the presentations earlier today, there were similar considerations about how can we actually connect more dots. So I think these are some of the aspects there. Again, the important thing is to remember not to extrapolate linearly because progress is not linear. And one of the biggest questions all the time on my mind is how can we actually build the layers of tools so that others can build on that. That's why I'm excited about eco-scientists. I'm excited about empirical research assistants and about MedGemma because innovation will come from others based on that, on research, on applications, on execution.
Yeah. Thank you. We do a lot of opportunistic screening in this country for various diseases. do you think we can detect it in a pre-malignant condition? We are finding it very difficult, especially the cervical cancer and oral cancer. The engineers are finding it difficult to match and detect the pre-malignant condition. What is your answer for how we can go about in opportunistic screening? We do it routinely.
So I try to look, again, I'm trying to think about it, not necessarily what can we do today's technology, but how can we set up so that future is going to make this step function. Now, when I talk future, future is not 2030 or 2050. Future can be 2 years from now in the progress of AI. So the big question in my mind is how can we take all these data and screenings, and I just actually heard about wonderful initiatives from Dr. Chinnababu about more and more screenings out there in the outskirts, you know. And so in my opinion, as a community, if we can bring more data in a safe and responsible way, in a way that we can then allow others to build on that in an open way, and again, these discussions I'm having quite a few, how can we make sure that we can get that? Because I believe the signals are probably there. So if we get enough data, and then we have the models are keep making progress, and we let the innovators actually build on that data, build on the models, and that's why we're giving the tools for researchers, then I'm positive that we're going to get huge transformative changes in many things that today are unlocked.
Yeah.
And I think Dr. Chinnababu mentioned this notion of let's identify cancer before it actually happens. I truly believe that we're going to do that in the future. And the question in my mind is not how do we find a solution today, but how do we set it up in the right way so that it will be found in the future.
Thank you, Mr. Yossi. I think it was a wonderful overview of a global perspective and a national wise in India. So in interest of time, I think I understand there will be many questions, but we will discuss over the lunch. So I hand over, and thank you. A good round of applause to